Hello and welcome to my channel. My name is Sahithya. I am a mental health professional and I'm here to talk about mental health and mental health issues. I feel that if I can reach out to a few people who are in distress, who are looking for support, who are looking for some guidance, then I would have achieved my goals. Stay tuned here because I'll also share some tips to manage stress and strategies to handle difficult emotions. Once again, welcome to my channel. No one is immune to stress or mental health difficulties. As per the World Health Organization estimates, 1 in 8 or about 970 million people around the world were living with a mental disorder in the year 2019. Depression and anxiety were of course the most common. These figures are from before the pandemic. Now they may have gone up significantly. If mental health conditions are not treated in a timely manner, it can lead to a lot of disabilities, socio-occupational dysfunctions, and even suicide. In fact, suicide is one of the leading causes of death among the youth. Worldwide, every year, more than 7 lakh people commit suicide, and this is a preventable death. And for every completed suicide, there would have been many more people who have attempted it. Apart from suicide, people with severe mental health conditions, they die prematurely, as much as 2 decades early due to physical health conditions which are preventable. This is why we need to talk about mental health as openly as we talk about our physical health. We need to remember that each of us are vulnerable to mental health issues. Life is definitely challenging. We are often confronted with tough decisions, stressful life events, financial difficulties, relationship problems, commitments, pressure to deliver results, loss, burnout, trauma, and sometimes things like tsunami or earthquake or even the pandemic we just went through, they just strike out of nowhere and they totally mess up our lives. A lot of times, life doesn't turn out the way we want it to, and it can be quite disappointing. So who doesn't go through these situations? And this includes health professionals as well. In fact, research suggests that a large number of health professionals, including mental health professionals, experience depression. So let's leave the stigma out of it. It's no longer frowned upon like it used to be decades ago, and depression is not a sign of weakness. When you seek help, there is help available. And with a little bit of support, changes to the way we think and react to situations, and with some skill building, we can all navigate through life successfully. The information that I provide here, they are meant to assist you in understanding your experiences and finding support. Maybe you can use some of the tips and strategies that I share here for self-development, but they should not be considered as a substitute for professional help. Especially if you're experiencing some mental health symptoms like being sad for a very long time, you're withdrawing from your family and friends, your energy levels are low despite being physically healthy, and you are not able to enjoy things you used to enjoy before, or you're having anxiety symptoms like excessive worries or excessive fears, or you could be having flashback from past traumas that are causing distress in the present, or you could be hearing voices or any unusual experiences that are disturbing you, then it's very, very essential that you seek a mental health professional. When I say mental health professional, it could be a psychiatrist or a clinical psychologist. It doesn't matter, just visit one of them. Because if a psychiatrist feels that you require therapy, they'll do the referral. And if a clinical psychologist feels that you need medication, again, they will do a referral. So when you come to us, we usually work as a team. We will do a detailed evaluation. We'll ask questions about your symptoms and maybe run some tests and then make a diagnosis, and then we start a treatment. Treatment can be psychotherapy alone, or it could be medication, or it could be a combination of both. Like I mentioned earlier, everyone is vulnerable, so don't hesitate to seek help because you're not alone in this. So this brings me to the end of the video. I hope I have given you an overview. If you would like me to cover some topics, or if you have some specific queries that you want me to cover, please feel free to message me or leave behind a comment, and whenever time permits, I'll try to make a video of it. So once again, Welcome to my channel. Stay tuned for my videos and I'll come back with the videos soon. Until then, take care, stay safe and bye.